Most common diseases diagnosed among the newborn baby is jaundice, but not all newborn baby will having the risk to get it, as it depends on the symptoms and causes. However, parents still need to equip themselves with some knowledge in managing jaundice because it can cause long-term health problems in rare cases. We bring to you our pediatrician for some insights to mommy and daddy out there.
Okay, so neonatal jaundice is actually a very common condition, especially during the first week of life of a newborn. So it affects about 50 to 60% of newborn within the first week. Normally, it happens after 48 hours of life. What happens is the old maternal blood that has been circulating in the baby's body currently is being broken down, and inside those broken down there's a substance that is called bilirubin. This bilirubin is supposed to be excreted through the liver, converted into something that is diluted in the urine and then passed out through the urine. But since the liver is still new into this and it cannot fully clear all the bilirubin at one go, that's why the bilirubin level is increasing in trend, and then we will notice that the baby has jaundice. As part of the standard practice, before discharging a baby, we will definitely do a bilirubin level through a heel prick, and with that level we can decide how long we should wait for the next level taking to be. Usually it will be around 1 or 2 days time we will do a second check and to see the trend of increasing of the bilirubin level. Through untrained naked eye, sometimes you can notice jaundice by looking at the sclera of the eye, the white color part. It will appear to be, there will be a tinge of yellow there, and sometimes if it's high enough, you can notice the skin will appear yellow as well, starting from the head downwards to the toes. But this is not an accurate way of assessing jaundice, and you still need to do blood taking to help us decide how severe is the jaundice, how rapid the increase of the bilirubin level is, and that will help us decide whether the child needs to undergo phototherapy or not. Neonatal jaundice most of the time is considered something to be physiological, which is actually normal. So there is no need to be overly concerned and to try so hard to prevent jaundice from happening. So not all jaundice needs treatment. Most of the time the jaundice level is not high, and we don't really need to start any kind of treatment. Treatment is only required when the jaundice level is higher than what we expect at a certain age group, and at the same, or if the jaundice level increment is very rapid, then we will need to consider treatment. There are two treatment options. The most common one would be a phototherapy, which is putting the baby under a blue colored light, and using the light we can bring down the bilirubin level and can be discharged normally within 1 or 2 days time. If the jaundice level is excessively high, very high, or if the increase of jaundice is very rapid, then sometimes by phototherapy itself it cannot bring down the level fast enough. So what we do in this kind of situation is to do an exchange transfusion, which basically we will remove the portion of the baby's blood and replace with a donor's blood, so that we can bring down the bilirubin level as fast as possible. But this is a very drastic measure and is only reserved for very severe cases.